the launch of Atlas by Shatterproof in Florida. It's an exciting day. I'm Dave Pizzo, Florida Blues West Florida Market President. And we're excited to share today another milestone in Florida's ongoing commitment to combat opioid and substance misuse in Florida. It's very fitting today that September is National Recovery Month, and this is the first day of the month. So it was just awesome that we could schedule this today for this great announcement. I'm also the chair of Live Tampa Bay, formerly known as Project Opioid Tampa Bay. The mission of Live Tampa Bay is to reduce opioid deaths a bold amount by 50% over the next 5 years. If you're a member of Live Tampa Bay leadership or stakeholder coalitions or even the Tampa Bay Partnership that's been instrumental in helping stand this organization up, please raise your hand and be recognized. Great, thank you. Now I'm told we have a great attendance here, but we have about 90 people registered for the streaming version of this. So there's a lot of people that couldn't be here, but they're participating in this press conference and then the training session afterwards. So stay online if you're joining us for the press conference, and you'll move right into the training session. So thank you for that. I'd also like to acknowledge and thank any elected officials who are with us. We appreciate you joining us as we tackle an issue impacting nearly every Floridian. You'll meet Attorney Ashley Moody in just a few minutes, but I know that Representative Susan Valdez is here too. Susan?
Good morning.
There you are. Thank you for joining us. And in addition to our State Attorney General, Ashley Moody, again, who's here, and we'll introduce her in a moment. Thank you for coming today. We have Doug Simon with us. Doug, as you know, is the Director of the Office of Drug Control and is also known as the Drug Czar. Doug? There he is. And yesterday, Jennifer Webb from Live Tampa Bay and I had the pleasure to go with Doug and to spend a good amount of time at Tampa General with some of their clinicians, John Corus, the Central Florida Behavioral Health Network, and really learn about their amazing results they're getting in their Bridge program. So thank you for that. Robin, thank you for representing Tampa General here today and our leadership coalition. As I said, September is recognized as National Recovery Month, and today's announcement with Shatterproof and our community partners is vitally important to the recovery of health of Tampa Bay. Today, Tampa Bay's opioid overdose rate is 23.3 people per 100,000 population, and it's 9.7% higher than the state of Florida and 50% higher than the nation. That's bad. We got to address this issue. Every 94 minutes, someone is admitted into a Tampa Bay emergency department for a non-fatal overdose. That means frontline health professionals working in these situations have 108 opportunities each week to potentially save a life. And on top of that, there are over 30 people lost every week to opioid overdoses in Tampa Bay. And that's not acceptable. That's why we're here today, to help save lives by bringing Atlas to families in Florida. Now I'd like to introduce my colleague, Susan Toller, Executive Director of the Florida Blue Foundation, to share more about Florida Blue's partnership with Shatterproof and the significance of Atlas coming to Florida. Please welcome Susan.
Thank you. Hi, good morning. It's wonderful to see all of you in person, and welcome to those who are joining us online. I'm really excited to participate in this exciting announcement. As Dave said, the opioid epidemic has impacted the lives of thousands of our family members, friends, colleagues, and neighbors. Today's announcement is a positive step toward providing meaningful help to those impacted. I'm really grateful for the strong partnerships and the allies that we have. As I lead the Florida Blue Foundation, we are all about collaborative partnerships in the nonprofit community, with government, and with business. And so this is an exciting day. I really want to thank Attorney General Ashley Moody for your leadership and being here today on this issue that affects so many Florida families. A big thank you to David Pizzo and his West Region team. West Coast is the best coast, as they say. So we're really proud that he is chairing the Live Tampa Bay Coalition. To Gary Mendel and his team at Shatterproof, you will hear in a few minutes the passion that Gary and his team have. We were able to share breakfast this morning at the hotel, and I am always inspired and moved by Gary's focus and tireless commitment. Thank you to Jennifer Moore with the Crisis Center of Tampa Bay for being a partner as well, and to the fabulous Jennifer Webb and Al and the team at Live Tampa Bay. Thank you for your commitment to help out. It takes all of us, as you can see, to work together as a network of support to address this epidemic that is crushing individuals and families and really challenging us to live healthier lives. For many of us, it is personal, right? Either directly or indirectly, we all have a story. It's unique in that this affliction affects both the mental and physical well-being of those, but also has an impact on those who are related or affiliated with those who are suffering. As we know at Florida Blue, and you know, there's no health without mental health. Our mission is to help people in communities achieve better health, and that means both physical and mental health. As Dave said, the opioid crisis is rampant around our country. It's estimated that 100,000 people die a year from an overdose death, but in Tampa Bay, at least 30 people here each week die from an opioid overdose. During the pandemic, that only increased, and we saw an increase in deaths. It's important that we understand these numbers, but it's also important to hear the stories, and you'll hear some of that today. As I said, we do care at Florida Blue and the Florida Blue Foundation about all of our members and our communities. We're committed to playing an active role in this solution and believe that it takes all of us. Some of the things that we've been doing with our foundation, funding innovative programs to parallel the efforts that Florida Blue has been taking. We were one of the early adopters of a program to address the opioid epidemic by putting peer recovery specialists in hospitals, funding enhanced screenings and prevention efforts, as well as expanded therapy options. We launched Project Opioid in Orlando in 2019, and we expanded that across the state. We now have Project Opioid coalitions in all of the major markets in Florida, and here, that's Live Tampa Bay. On the business side, Florida Blue was the first insurer in the state to eliminate coverage of OxyContin several years ago. That has made a tremendous impact on our members and their health. Our Florida Blue Medicare team partnered with our pharmacy benefit manager, Prime Therapeutics, in a pilot program recently to identify members who were prescribed opioids but might be at risk for addiction, and that program has already been successful. We are excited to announce this partnership today because it makes treatment options more accessible, more transparent, and available to those who need it, and it creates hope. Hope for those who are addicted to get out, hope for those families to get help, hope for the stigma. Gary and I talked about that this morning, that the stigma around mental health and especially around addiction is still there, and we've got to eliminate that and make it comfortable for people to talk about the challenges that they are facing. Again, I'm encouraged by all of you being here. Thank you for your commitment. To talk more about this, please welcome Gary Mendel, the founder and CEO of Shatterproof. You'll hear he's a national nonprofit dedicated to reversing the addiction crisis. Gary founded Shatterproof after losing his son to addiction in 2011, and he is passionate to spare other families from that tragedy. Following Gary, we'll be joined by Attorney General Ashley Moody as chair of the statewide task force on opioid abuse. She's been a tireless advocate for Florida families affected by this crisis. Thank you so much, Gary.
Well, thank you all for having me. Susan, thank you. And just a few thank yous to start. Dave, thank you very much for the introduction and being here today, and for both of you and Susan for everything that Florida Blue has been doing. Can't thank you enough. Nick Dewan is also a strong representative at Florida Blue who couldn't be here today. But without Nick's help, we wouldn't be here today. Nick was very instrumental in working with the team at Florida Blue to get this project funded to bring it to Florida. Doug Simon, we haven't met yet in person, but we've spoken on the phone. Thank you so much for, when I reached out to you several months ago, you responded like in 2 hours, and we had a call the next day. And I know you've been working with our policy team since, so thank you so much. Looking forward to meeting you in person right after this. Attorney General, I can't say enough. We met actually through a personal contact and spoke several times, and the Attorney General, I don't think I've met anyone who's more passionate about this cause than I am, or equally passionate. And we just started with a short conversation that turned into several about her passion to help people in the state related to this cause. So I am honored to be next to you on this in partnership with you, so thank you. Also, Jennifer Moore, Jennifer Webb, Representative Valdez, thank you all for being here. It's my honor to be here alongside you. I'd like to begin with just a little bit of my personal story to bring this home. My career was not in healthcare nor in nonprofit. I was raising my family in a small town in Connecticut, and my older son Brian was struggling with addiction. He was diagnosed, I don't know if it was diagnosed at that time, but he started having issues when he was about 16, 17 years old. And once he developed issues, he went to 8 different treatment programs over 8 years. And you'll hear story after story that replicates mine. We had no way to understand the system. One of his better friends was struggling with cancer, and his family was easily able to access the highest quality medical care that was all based on science, on research. We had no idea. Finding treatment programs was call a friend, Google, call a friend of a friend. We had no way to navigate this system. And the whole time in that 8 years, while his friend was struggling with cancer, Brian was also struggling with shame and stigma and feeling low self-esteem for what he was dealing with. But he tried his hardest. I actually remember visiting him at a treatment program here in Florida. And I flew in late the night before. I hadn't seen him in months. And I woke up early that morning. I just wanted to watch him sleep. And I walked into the room he was staying at 7 in the morning. And if you knew Brian, that was a big surprise to see him up at 7 in the morning. And when he walked in, I walked in the room and he heard me. He looked up at me with that big smile of his. He was laying on his book, flipping through his treatment book, laying on his bed, flipping through his treatment book. He looked up at me and said, "Dad, don't worry. I got this. I'm going to beat this." But addiction always doesn't work that way. A few years later, I was woken up in the middle of the night by my cell phone ringing. And when I picked it up, I was told that my son had just died. He was 25 years old, and he hadn't used a substance in 13 months. And equally tragic, it wasn't just addiction that took his life. It was the feeling of shame he had every morning when he opened his eyes. And he wrote us a suicide note. And he talked about the shame that he felt, the love for his family, how we all tried, the shame he felt that he left with us. And he also talked about the treatment system, how he went to 8 different treatment programs and everyone was different. And they really didn't understand what he needed. So as a father, it doesn't get much worse. In the coming months, weeks and months, I began to focus on 2 questions. What could I have done differently as a father? And what could be done to spare other families of the tragedy our family had suffered? I took what I thought would be 3 months away from my business and traveled the country, meeting with experts to answer those 2 questions. I was in DC a lot, meeting with the National Institute of Drug Abuse, with our federal agencies, with researchers all across the country, with advocacy organizations. And after 3 months, I came back home and I wrote on a pad a few things. How big this disease was. Yes, we talk about the number of people dying. At that time, it wasn't 107,000 overdose, it was about 35,000. But there's also 100,000 people a year that die related to alcohol. And there's another 40 times that number that live with this disease and don't die as a statistic. But they live subpar lives, many of them, not all of them. So number one, it was big. Number two, it's children. 8 out of 10 of those with a substance use disorder develop this disease before their 18th birthday. And we as a society are letting it happen. But the biggest thing I learned, by far, I wrote the word tragic. And by that I meant I had learned that the federal government had funded billions of dollars of research to researchers all across the country. And those researchers had used that funding well and created a wonderful body of knowledge. Knowledge that had proven without any doubt, randomly controlled trials, if our communities and our healthcare systems did certain things, A, B, and C, significantly less of our loved ones would use drugs and develop this disease. If our treatment system and our healthcare system did D, E, and F, those in treatment would do significantly better, on par with anyone being treated for heart disease or asthma or diabetes, any other chronic illness. Yet I wrote the word tragic because all this information was sitting in peer-reviewed medical journals, all being traded by the researchers, and it wasn't being implemented. Coming out of a career in business, I couldn't imagine that. Spending billions of dollars to create knowledge to solve a problem, and sitting there unused, mostly. As a father, I was destroyed. But coming from a background in business, I saw an opportunity. What our nation needed was an organization, not to solve this problem, but to form partnerships, to be the catalyst, to bring states together, health insurers together, community-based organizations together, citizens, families, and together, let's simply block and tackle. Nothing complicated. Take the science and get it implemented. With a vision that our society would look this disease straight in the eye, prevent it and treat it with programs based on proven research, and with love and with empathy, without any shame or stigma, just like any other disease. And from that, Shatterproof was formed. We now have 3 pillars of work, working to transform the treatment system, ending shame and stigma, and providing education to families and empowering families to make a change. Today, we're focused on one piece of that, transforming the treatment system in the United States. And a subset of that is Atlas. Atlas started with a very simple, not complicated vision. What this nation needed, which unbelievably it didn't have, was one national standard of care for the treatment of addiction. Unbelievably, we didn't have it. So we worked with the lead author of the Surgeon General's report in 2016, and we drafted and have gained broad industry acceptance on a documented national principles of care for the treatment of addiction. Whether it's outpatient, residential, opioids or alcohol, adolescent or adult, every treatment program should follow the 80-20 rule. These are the principles that make the most impact. And then, again, simple concept. Let's gather the data and show how every treatment program in the country is delivering on these principles. And so that's what Atlas does, and it does a little bit more. Atlas does a few things to remedy what I went through as a father and what many in this room went through as a father and what millions of people go through this every day looking for treatment. Number one, before you even think about a treatment program, do you need residential or outpatient? No one has any idea. I certainly didn't. For every 100 phone calls or emails I get, have you heard of this treatment program? Is it good? Does your son or daughter need outpatient or residential? I don't know. So we work with the American Society of Addiction Medicine, and over a year and a half, we developed with their science 13 questions, less than 10 minutes, free. Anyone in this country who's thinking about treatment can go to our website, take this assessment, less than 10 minutes, and get 2 recommendations. What level of care do you need? Do you need hospitalization, residential, intensive outpatient, or outpatient? And then from the American Society of Addiction Medicine, their science. And number 2, what additional services do I need? You can get a recommendation of outpatient, go to outpatient, but if you need medications for opiate use disorder, or example, you need mental health services, going to an outpatient doesn't have those services is not going to do you any good. So that's the second thing, the additional services. The third, and so if you take that assessment, it will filter the treatment programs and shorten the list to only those that offer that. Third, which treatment programs are in the network of your health insurer? So it's covered by your health insurer. And fourth, which treatment programs are following which evidence-based practices and which ones are not? That's Atlas, 4 things. And then you can further filter by adolescent or adult, or do they allow you to smoke cigarettes, or et cetera, et cetera. We have a bunch of other filters. That's Atlas. A simple concept. This is not putting somebody on the moon. It's implementation. Implementation with the partnership of Florida Blue, who supported us financially and with people and resources to bring this to the state of Florida. Now the state, we're working with Department of Children and Family Services, who had a conflict and couldn't be here today because they have their annual summit, who is now supporting us going forward to fund this every year and work with us as our partner. So we have a 3-way partnership now, and now it's going to go into a 100 organization partnership as communities get involved. And by the way, Florida Blue, just to mention, didn't support this just for their members. They supported it for everybody in the state, and they were very clear about that right from the beginning. This is not rocket science. This is bringing people together to implement the basics, blocking and tackling. And it's bringing people together. It's partnerships. It's all of you and all of you listening. In closing, I just want to echo, in addition to Atlas, navigating the treatment system to get the right treatment, stigma is also very important. You can go to the best treatment program in the country that has all the right services for you and the most appropriate for you. If you enter society where half of Americans are unwilling to be your friend, coworker, or neighbor because they found out that you have a substance use disorder, and you internalize that and believe they're right, how do you live? And the science shows that we can change this. Proven research. And we've implemented it now and it's working. So let's all join together. I often think of the last time my son came home for a visit. It was 4 months before he died. And that last night we're sitting on the back porch talking about his favorite topic incessantly, the New York Giants and Eli Manning. I'm sorry about that. And then the conversation turned to his recovery. And he said, "Dad, I wish that someday people would realize I'm not a bad person. I'm a good person with a bad disease. And I'm trying my absolute hardest. I promise. I promise." So together, join with Shatterproof, join with Florida Blue, join with the state, all of you. Let's create awareness so everyone looking for treatment in this state goes to Atlas. Let's create awareness of people who've been treated so they go to Atlas and leave a patient review. Let's join with us to show empathy and respect for those simply with a chronic illness. Together we can do this. Thank you. Thank you. It's now my honor to introduce Attorney General Ashley Moore, and I'm proud to call her now my friend. Thank you.
Only my good friends can call me Ashley Moore when they're nervous. Otherwise, Moody is not a hard name to remember, is it? It's a lot to be moody about right now, and that includes the over 100,000 people who died last year needlessly from an overdose. And when we talk about that number, you know, in government, I often find myself talking about numbers a lot, and generally they're really big numbers. And I think it's always helpful to put these things in context. So when we talk about over 100,000 people dying, 107,000 people dying from an overdose, we've lost more Americans in war. And that's just 1 year. As a former judge, as a wife of a law enforcement officer, but most specifically as a mother of two young boys, we as a country have to start paying attention to what is going on and what is killing a majority of Americans, working age Americans 18 to 45. And that is the deadly drug epidemic that we are facing. And this crisis is only getting worse. And I say that because there are external pressures that are fueling this addiction crisis, and we have got to recognize the realities of that. So right now, and the DEA would tell you this, and is telling Americans this, fentanyl, which is a synthetic opioid, is more dangerous, more potent than any drug that they have been dealing with. And it is being manufactured in Mexico. It's cheap synthetic drug precursors. It's being manufactured there and then pouring into our nation. So, you know, just within the last couple years alone, we have enough fentanyl flooding into the country to kill the entire US population 7 times over. But why do we in this room, who are cognizant of our addiction crisis and the number of people that are presently addicted to opioids, why is this external threat, this external pressure so important? Because that synthetic opioid is so cheap, now so readily available, that those who are peddling these poisons of drugs in our community are now lacing traditional drugs with this fentanyl, and it is killing people at record rates. And as a mother, I can tell you one of the most shocking things is that our children are being purposefully targeted. They are being targeted online with these pills. Now we see them in 18 states and encountered at the border that are in rainbow-colored pill form. Rainbow-colored pill form. I'm telling you, that's not our adults they are trying to attract into addiction. They are being targeted online, and we are now hearing warnings from the DEA that parents warn your children, because this is so deadly, it's being laced with traditional drugs, and this can kill them. And we are seeing parents losing their children at exponential rates. So we have this addiction crisis going on, and now it is like throwing gasoline onto the fire because of this external threat of fentanyl and the lack of border security and interdicting that presently right now. So I need to put all of you on notice right now, and anyone that is paying attention. Now is the time we must push treatment for addiction. Because if you thought addiction was dangerous before, as we sit here today, we will lose people that take an illicit substance having no idea there's a synthetic mixed in, and they will die. And this is just not a hypothetical, this is not in theory, it is happening every day. And as a mother, as Attorney General, it is disheartening that I am having to warn parents. Shield your children, warn your children. I've had the uncomfortable conversation with my own. If it's not youth, if it's adult, regardless, If you have an addiction and you are struggling, now is the time to get treatment. And one of the things that I've been pressing since being Attorney General is a place where someone can go and match. Are you self-pay? Are you insured? Do you need help? How do you match that with the level of care and have that associated where you are presently living? If you are a mom and you have a child struggling, where can you take them? And if the only place is a couple of hours away, know that immediately so you can start figuring that out. It shouldn't be a couple of hours away, and we want to work on that. But you have to start with what is readily available to you based on your level of care at this moment. And if you have been struggling with, when do I make this jump? When is the right time? Now is the right time. Because no drug use is safe right now. No drug use has been historically safe because of the probability that you will become addicted, the probability that it could lead to other drug use. But right now, because of the danger, the prevalence of fentanyl, carfentanil, these other dangerous chemical synthetic opioids in our country, we have to be on guard and we have to be vigilant. And so I am incredibly excited to announce this new tool, which you can easily access at treatmentatlas.org, or you can go onto our statewide resource, doseofrealityfl.com, which we have linked to Atlas. And whether you are someone struggling yourself or whether you are someone who is desperately trying to save someone you love, don't wait another minute. Go on today and use this easy-to-use resource and find help. Because today it is more important than ever. And as Attorney General, I am so proud of our dogged, diligent litigation efforts to make sure that we got resources into the state to do just this, to start addressing the addiction crisis. And I'm so proud that those efforts have helped fund this and will continue to help fund these tools. And I expect that you will see more and more resources and practical ways that family can get their arms around addiction of those they love and start making progress towards the healing of that loved one. So I appreciate those of you that took the time to be here. I know you've traveled from all parts of the state to recognize what an important announcement this is for Florida, for families, for those struggling with addiction. It was my honor to be here to make this important announcement, and we need to continue to start getting the word out to those struggling. Now is the time to take action. Now is the time to take that first step towards recovery. It will save lives, and we will be a stronger, safer Florida as a result of these efforts. I thank you very much.
Thank you so much for your passion and your vigor, both of you, Gary and Attorney General Moody. We are very fortunate to have you, both of you, and many others with similar passion that are here today, and many can't be here today, really fight this. I love what you say about now is the time, because every minute we wait is another person affected and another death. And whether it's from the opioid itself or the stigma that you associated with it, that's just as bad. And thank you again for sharing your story and what you're doing to lead us in this country. It's making a difference. And I'm proud, Florida Blue is proud, and we're all proud here, Tampa Bay, and everybody joining us for what you are doing. You heard the word collaboration a lot. I think everyone that's spoken so far talked about collaboration. No one person or entity can do it alone. It's just not possible. So it's only through collaboration of industry, nonprofits, individual, faith-based organizations, elected officials, law enforcement. The list goes on, but it's only through really good collaboration, thinking about what the end in mind. The end in mind is saving people's lives. So I'm bullish that the Atlas tool, but all the things around it and the collaboration and the visibility of this issue in the marketplace is going to make a difference. But speaking about collaboration, we wanted to highlight a few nonprofit partners that really are doing great work. I mean, we could have a list of 100 here. But up next, we're going to introduce the Crisis Center. Many of you know in Tampa Bay, the Crisis Center, it's a great organization. They are run by the incomparable Clara Reynolds. She couldn't be here today. She's at a conference also in Orlando at the same time. And we have another representative here from the Crisis Center. But they're a nonprofit organization for all the people who struggle with a variety of crisis situations, including substance abuse, sexual assault or abuse, domestic violence, financial distress, medical emergency, suicidal thoughts, and other emotional or situational distress. They run the 211 hotline, the suicide hotline, and now the 988 hotline here in Hillsborough County. The work is courageous and truly 24 hours a day. You'll also hear from Live Tampa Bay. I mentioned that earlier. It's comprised of regional leaders committed to drastically reducing the number of opioid deaths by 50% in 5 years, a simple, bold goal. I'm honored to chair that organization. It's a remarkable group of faith, nonprofit, clinical, philanthropic, government, and law enforcement leaders and others fighting this cause. And congratulations to Jennifer Webb, who leads Live Tampa Bay on her recent appointment by the governor to the Florida Commission on the Status of Women. You'll hear more about the valiant work of these strategic partners, starting with the Crisis Center, who's also celebrating 50 years of service in Tampa Bay. Jennifer Moore will be representing him today. She's the VP of Development for the Crisis Center. After that, you'll hear Al Kinkle of Kimmy's Recovery Zone and his personal story and journey of his daughter, and Jennifer Webb, Executive Director of Live Tampa Bay. So it's my honor to now turn this over to Jennifer Moore.
Thank you, Dave. Thank you, Florida Blue, and all of the community partners that are bringing this amazing resource to the state of Florida. The Crisis Center of Tampa Bay answers the statewide substance abuse hotline, and so far this year, we have already answered over 19,000 calls. Individuals are calling from throughout the state of Florida seeking resources and facilities for substance misuse. Individuals are calling every day seeking support that they're unable to find themselves. Alcohol and opioids are the most common substance that individuals are calling us to seek support, and including the most common facility that they're looking for is detox. For the community, frustration is the biggest emotion that we hear first. Frustration from an individual that is unable to control their urges and feel guilt. Frustration from an individual that is unable to find a facility that takes their insurance. And then calls from family members and friends of someone that is struggling with substance misuse. Calls from individuals that are overwhelmed by trying to find the resources and how to help someone navigate this problem, this disease. The Crisis Center of Tampa Bay also answers the 988 Suicide Crisis Lifeline. Recently changed to 988, which has been a wonderful, wonderful thing for our community. We know that substance abuse and mental health issues go hand in hand. Every unique situation, every caller is greeted by a compassionate individual, a compassionate staff member that's there to support them and help provide them with resources without judgment. We are very pleased to be here as a part of the Atlas launch and excited to see this resource come to our community. Thank you. Al?
Good morning, everybody. I'm pleased to be here today, and before I get started, I'd like to thank Florida Blue for touching me through my daughter's crisis of addiction and mental health. We worked together quite a bit over in Palm Beach, and I just want to thank you for that. And I also want to thank Gary for being a beacon for my search to find the answer for mental health and substance use disorder. I've been a follower for Gary for many, many years, and today's the first day I met him. And thank you, Gary. Thank you for what you're doing. The Alliance is going to mean a lot to us. And for everyone else that's here, I really, really appreciate the time that you're taking today. Because when we talk about mental health and substance use disorder, and we meet a lot of people like yourself, you know, my question is anybody in the room that doesn't know somebody or isn't affected by mental health or substance use disorder? And I asked them to raise their hand. I'm not going to ask anyone to do that, but that tells the truth. I mean, I think it affects everybody. We talked a little bit about peer specialists. That I am a peer specialist thanks to Ken Brown from DCF sitting right in the audience, and thank you, Ken. And you know, just yesterday I was talking to a parent that not only lost one child not too long ago, but lost her second child from endocarditis. And endocarditis, if you don't know, it's a valve replacement. And then if you replace the valve and don't fix the brain, you're going to wind up in a bad situation, you know. And so they're the things that over the past 6 years that I've been working with. I come out of the country club business. I've been a chief operating officer for years in that end of the business. But I also am chairman at Children's Hospital, Galveston's Children's Hospital in Fort Myers. So when, like Gary said, when you look at what we've done with children with cancer over the past few years, the survival rate today is unbelievable. But we threw an army at it. And the difference is, and with substance use and mental disorder, we don't have the service or the funding or the army that we need to defeat this. Today, fentanyl, with the presence of fentanyl in everything that you touch today, and I get that from the sheriff's offices and from everybody that's been around marijuana, they're dusting with. So it's not a matter of when something tragic's going to happen. It's going to happen because today, with our children, the story that I'll relate to, one of our neighbors last week came in and talked to us, and our child was on Snapchat, and on Snapchat they wanted to pick up some Percocet, and when they went over there, it wasn't Percocet, it was fentanyl, and they put that on Facebook, and the child OD'd on Facebook and died. So our children are in danger, we're in danger. This is a big issue with us. The time is now. We don't have time to waste to make a difference. With Kimmy was had mental health and substance use disorder for 20 years, and she fought very hard. She was just like any other child, beautiful young girl, little model. She was a model. She was in love with life. She was just wonderful, had a big heart and a big soul, just a normal kid. But about 13 years old when she discovered pills, and that started our journey. And for 20 years, I stood next to my daughter with the stigmatism and people telling me she would be better off dead than living with an opioid or mental health disorder. And that's really difficult. And people believe that today. They believe we can't be cured. They don't believe in recovery. Recovery's for everybody. We can recover, but we need places to go. And we need what Atlas is doing today. I thought I was on a merry-go-round trying to find a facility for my daughter, a facility that was capable of handling the disease. And just like our last epidemic, it was difficult to find a way to handle that disease. Well, we're in the same boat right now. How do we handle mental health and substance use disorder? Well, we start with programs and facilities that are going to be recommended by Atlas. And I'm so happy it's coming to Florida. You're going to change the lives of families. It was frustrating. My wife and I cried many a night because failure after failure after failure, 30-day programs, 10 30-day programs. You know, so what I guess I'm saying, we started Kimmy's Own then. We have also Kimmy's Angels. Kimmy's Angels is for children with cancer, and that fund was developed by Lee Health Hospital for my daughter, and that is for support to moms and dads that need support. So Kimmy's Angels is that support system. So with that, my heart was in addiction, and I wanted to start something called Kimmy's Own, and in that fund there is a support system, a collaborative system. I happen to be blessed in Fort Myers. We have a hospital that works with us. We have facilities that works with us, and we are collaborating every single day. So Fort Myers is stepping up to the plate. And when I walk around this room, and I spoke to so many people today, I feel that desire, I feel that love, I feel that kindness in this room. And we're all going to go out of this room today with a better perspective of what's going on. Because the death of somebody from the use of drugs or mental health can be prevented, and we can do it. You know, I called it a tsunami, and Gary said to me, yes, Al, we are in a tsunami, but we can control it. And Gary, thank you for telling me that, because I didn't know whether I could control it. So thank you, appreciate it. So anyway, like I say, I as a peer specialist, I talked to so many people, and I've never talked to this many people since my daughter passed away. So we are in a crisis situation. Please go out, spread the word. I'm so proud to be here today to be able to give a little bit of time and brain power that I have left to maybe make a change. And Tampa, thank you so much for what you're doing. You're going to make a big change here. And everybody in this room will go out today with a different perspective and help somebody. Thank you so much, and God bless you all.
Al, when you were speaking, you reminded me of the night that I got the call from my little sister, Allison, who had called and said, Sissy, I think that I have a little bit of a problem with OxyContin. And I said, what do you mean a little bit of a problem with an opioid? And I was like, what does that look like, Al? And she went on to describe it, and the next step was me involving my mom and dad and seeking to get her help, but literally what we did was we pulled up the white pages online and started going program by program, hoping that the websites that were linked were accurate, praying that the information was solid and that their outcomes were as good as they claimed, and then only to find out sometimes they took our health insurance, sometimes they didn't. But you know what the truth is that we spent all the resources that we could to help and try and get Allison the care that she needed. And unfortunately, like Gary's son Brian, it was the stigma that ended up taking her life, because she ended up slipping and relapsing on her road of recovery, and the shame that she felt caused her to pull the trigger as we were running towards her, begging her to put the gun down. And that's why I'm here today. Y'all, my name is Jennifer Webb. I am the executive director of Live Tampa Bay, and I am so grateful for the tool of Atlas and for Shatterproof, for Florida Blue, for helping to fund it, for the state of Florida, for pulling together this partnership and making sure that we're amplifying the number of treatment facilities and outpatient facilities, and hopefully one day recovery communities that are included in recovery services on this platform. And I think also, and I'm looking over at my prevention crew over here, we really spoke about how important prevention is and that one pill can kill. And thank you, and thank Drug Free America and all of the anti-drug coalitions for the work that you do. Because if kids don't pick up, then they can't die. And right now, we are in a situation where it's more deadlier in the United States to pick up, to buy an illicit pill than it is to play Russian roulette. It is more deadly today to pick up an illicit drug from the street than it is to play Russian roulette. But for those of us who have loved ones who do go down that pathway, and you know, I am, because it is September 1st, and we are launching Recovery Month, I am also a woman in long-term recovery, and for me that means 23 years without a drink or a drug. And having the opportunity to give back to my community and serve my community and work with families and amazing organizations. But for those who are still struggling on their road of recovery, once they get into recovery, then if we can keep them there, if we can pair them to great treatment services, use this tool to really connect folks, have what Tampa General calls a red carpet handoff. I think it's such a great term, but really work with individuals to meet their needs. That's when we start to change the narrative. That's when we see our numbers reverse. And I want to mention a little bit about research, and I love Shatterproof and the work that Atlas does because it is so steeped in peer-reviewed literature and the research that is out there. And what Live Tampa Bay does on a regional level is to do regional research and take data-informed action. And because of that, Live Tampa Bay is steeped in the regional impact of the opioid epidemic, as well as in the family heartache and tragedy of this disease. Yesterday, we commemorated the lives lost to the opioid overdose epidemic. In the Tampa Bay region, Dave mentioned this early, we lose over 30 people every week just to opioid overdoses. Daughters like Kimmy, sons like Brian, daughters like Allison, or sisters like mine. This is a tragic loss of life. 30 people every week. Yet, each day, an average of 34 calls are made to EMS. I want to thank law enforcement that we have in the room today. And these calls result in lives being saved. This is 238 opportunities each and every week to connect someone who has survived an opioid overdose to the care that is appropriate for them and their families. And really talking and listening to those families who have survived an overdose along with the person who has survived an overdose, it's clear that they have been waiting for a tool like Atlas. They and their families deserve reliable information about treatment programs. They deserve to know actual outcomes. They deserve to have the process of finding a program that is right for their loved one both demystified and destigmatized. The first call saved the life of their loved one. Atlas will help to ensure that the second call made by these survivors is one that will connect them to the life and help them to thrive. Connection, after all, is the opposite of addiction. Thank you all for joining us today.